Am I right? So whole body was attacked with COVID pandemic. Yeah? Do you get me? And so, normally 12 to 20 breaths is a normal breathing pattern every human have. That's a normal healthy range. If you're having any pathological conditions, your breath may be lower or higher depending on your pathological condition. But I'm talking about normal. How many breaths per minute? 12 to 20 breaths per minute. Yeah. So 12 to 20 breaths. The heartbeat is more. So people, when I ask the breaths, people might actually confuse with the heartbeats. Yeah. So heartbeats is around between 60 to 120 normal beats. Yeah. So this breath, the 12 to 20 breaths per minute, taking an average of just 16 breaths per minute is a healthy range between the 20. We breathe 23,000 times a day. Yeah. Never when we realize that we breathe that much. Yeah. Any clue how many thoughts we have in our mind?
Do you mean like day and night sort of thing, like in 24 hours?
In 24 hours, if you're taking that 16 breaths as a median, so it is calculated to be 23,000 a day.
Yeah.
Yeah. But we never knew that we do that much of breathing. Yeah, because it's in autopilot. Until and unless you're gasping for breath, running up for the flight of stairs or climbing a mountain or anything, then you recognize, oh, I have to breathe more. Yeah. And any guesses around how many thoughts you have in your mind a day?
Thoughts. Well, I do practice mindfulness, but probably, yeah. I mean, you couldn't say exactly because some people are going to get more than others. Maybe 60.
60.
Yeah.
So 60,000 thoughts. We have 60,000 to 80,000 roughly, which the research confirms. And we have 23,000 breaths in a day. Yeah. We never realize our breaths, but do you know our emotions and breaths are best friends? Whenever you're anxious, do you feel your breathing is getting faster and shallow?
Yeah, the two go hand in hand.
Yeah. And I've spoken this many times to this group, yeah, because we've been meeting last 4 weeks. And so, and when you're actually getting into anger situation, yeah, you feel a tightness in your chest, middle of your chest, a clench in your chest, yeah. When you're at the same time on the other side sad, okay, which we all go into sometimes in the day or sometimes in the week due to some situation, how do you feel? Your breath is actually slow, very much slow and depressed. You don't want to do anything at all. Yeah. And when you actually calm, again it is slow, but in a way of good way, it's content. So your breathing is so easy flowing and content. So different emotion, these examples is to make you realize different emotions causes your breath to have a different tone, rhythm, and pitch. Yeah, our breath has rate, rhythm, and depth. Okay, when we go deep into our breath, what it has. So our breath, when I say breath, it includes our breathing in and our breathing out.
Yeah.
Yeah, and it is always in a 1:2 ratio. But what we all do, because it's an autopilot, we breathe in and breathe out in a more of a proportionate rate and even more shallower, lesser. We're not breathing out longer. We're not emptying our lung more as it needs to be emptied. Yeah, and so we are not making that much of space for a more fresh oxygen. And one thing which might surprise you, do you think your lung has age? Does your lung has age? Like if I ask you what's your age, you might come up with numbers. Yeah.
Right.
But do you think your lung has an age? It has an age. Okay, the lung specifically has an age. Okay, you might have actually noticed that whenever you celebrate your birthday, yeah, you blow a candle. Yeah, and it has been beautifully designed in every culture. Every culture has that to some most degree, like every culture has a birthday candle to blow out on the birthday. But it's beautiful designed, I say, because the way you forcefully blow that candle in a lesser second, that determines your lung age, lung health. Yeah, because your lung age is determined by the way you breathe out forcefully, the first second of the air, how forcefully you blow out, and the ratio of how much your lung can hold, the force vital capacity, and that predicts your lung age. Okay, and the interesting fact, an important fact which I wanted to say to you now, which you might be surprised, after the age of 30, their lung age declines, their lung function declines. Yeah, which means the lung capacity declines.
After what age?
After the age of 30.
Oh, 30. Okay.
Yeah. Have you seen anyone, or have you been into the lung function test, like blowing out through? Yeah. So that's what they use to predict that age, that lung age. Yeah. So that declines faster. So every year there is a fractional decline.
By doing breathing exercises, making sure you eat healthy,
Eat healthy. Yep.
breathing as much clean air as possible.
More
Clean air.
clean air. Yep.
Polluted air.
Yeah, absolutely. When you say breathing exercises, what do you actually mean by that? Is it like your meaning is you do breathing exercises to improve your conscious deep breathing? Am I right?
Which is deep breathing. Yeah, I guess so.
Yeah. So that's something which we actually can do every day. Yeah. People actually are referred to do breathing exercises by a physio, as I'm a respiratory physio. Only people have a lung problem. But we all have the responsibility to maintain our body's health. Am I right? And we actually snap to people. We actually react to people immediately. But we never think, how is our breathing going when we do that? Have you ever noticed that?
Yeah.
Yeah. And that is actually the right way of breathing will also protect a healthy relationship with others. Do you agree? If your breathing is right, your breathing and your emotions are best friends, so you can deal with situations more calmly with less ego. Am I right? So breathing is there for us to get the oxygen from our external world into our body with the fuel, the main fuel, which actually fuels our brain, which consumes for its own function 20% of the oxygen, and also nurtures the muscles in the body. Yeah, protects our heart, but it's the main thing, because when we think about the lifeline, we all think about the heart, because it is. And I would actually say people to think lung as a lifeline. Yeah, if lung is not there, even the heart cannot function. Yeah, so our lung is there doing a 24/7, helping us to live, thrive instead of surviving. But we are still making it to only survive rather than thriving, but not focusing on our breathing and doing the conscious deep breathing every day. We think that breathing exercise is only meant for people with lung condition. No.
Yeah.
No. Theme of this my work of Tele-Therapies and MindBody Synergy, creating that awareness. Breathing is not for dysfunction, only for dysfunctional lungs. Breathing is essential for every lungs to be healthy. Yeah. And as I said, that after 30 each year, our lung function declines gradually. And it is very important that we function
Even earlier than that.
earlier than that. Yeah, because what we do, people actually, the teens or the early ages, get into the habit of vaping and smoking. Yeah, even though there is a ban came down 2 years ago, but still is existing. Am I right? No one is actually, because everyone got attached and the pattern has been formed in the mind. People are struggling to quit. Yeah, so we are hurting our lungs by smoking and vaping, and we are hurting our lungs by breathing in the polluted air, and we are hurting our lungs by being inactive, which is a new smoking. Yeah, inactivity for an hour is a new smoking. Yeah, and we are also hurting our lung by dysfunctional thoughts, negative thoughts. Yeah, which makes our breathing to react. Do you get it? And so we are not protecting our lung, we are hurting our lungs more. And the one rescue, one wellness tool we are all having since the day we born on this earth is our breathing, to reset our body in a healthy way, which is meant to be functioning in a healthy way. Yeah? So that is the biggest thing, cause we are going towards spreading up in the community. Yeah? And as I said, the data, and I published some research in the chronic respiratory disease because I've been doing this work for more than 23 years. Yeah? And I'm more focused in the psychological injuries.
You say 23 years? Like, they don't really tend to talk about COPD that long ago, do they?
Say again?
They didn't really talk about COPD that much.
No, so in terms of the awareness has been less, but it has been existing. So COPD has been existing in the ages of the World War II, when TB was widely spread in the World War II, and that's when the pulmonary rehab started. It has a long history dating back to that, but it has been not much awareness. TB, tuberculosis, and people with tuberculosis have post-TB COPD,
Yeah.
which has not been diagnosed very well, rightly.
Yeah.
Yeah, and people, and also there is actually, as you might be aware of, the TB can come back, and there is professor in London. I just recently was invited to present my poster in Scotland, and at the time I was listening to his presentation, and the last 5 years the TB has been rising. It's not gone away, and this is the data from England only, and there is no proper diagnosis. And so the because TB is rising, there are some kind of protocols being brought in that every GP center should now reinvent the history of people with TB and recheck. And that is actually going on aside. So I don't want to shift the whole topic now, but yeah, that is the answer for your question is COPD and other things was not actually only recently. No, it has been there, and I was working in Ireland. So it is an education that needs to be provided to the whole family who is a part of, because different cultures have different ways of dealing with people having the chronic respiratory disease. So people with in Asian culture, it's more of family centered. People actually care towards like that particular person. The decision should be made collectively in the care of those people. And people who are actually in westernized is individualistic care. So people take care of themselves, and some might not have much support system, so they have to make the decision for themselves. It's so hard, and so they rely on the health system. Yeah, but the health system on the other side is lacking that support system or the workforces to create the awareness around this. This is something which I can actually describe as a scenario, like how anxious you get when your phone battery drops down to 8%.
I'm quite good at off-grid, so I don't even have Wi-Fi at home.
So most people actually, when their phone battery actually goes down to 8%, they actually look for a battery charger. The first action would be to charge it back, and because they don't want the phone to shut down. Yeah, and they dim the screen to save the energy in the battery in the phone. They might close all the apps and other things. They kind of get anxious into trying to save that phone not to shut down, because they know the signal of the phone, low battery, and it's showing an 8%.
Yeah.
What we do to our body.
That's that connection to the outside as well.
Exactly. Yeah. Yeah. But my question, real question is, do we actually listen to the signal of our body running down low?
Your body.
Running down low in charge, like mentally, emotionally, and physically?
Yeah.
There are
Spiritually connected you are, and if you're not, then you probably wouldn't notice.
no one noticed. But our body does send signals to our mind, and we are ignoring it. It sends signals.
That's
like
why people get strokes, isn't it?
Exactly.
They're ignoring all the signs, like they can feel their body, the headaches,
Headaches,
the
yeah.
exhaustion, like the severe aches, but they just choose just to ignore it.
Exactly. Yeah. We ignore it. We take care of our smartphone so well than our body and mind. Yeah. And especially our breath, body, and mind, we should be taking care of, because breath is a bridge between our body and mind. Yeah. The first moment we born on our earth, that is a wellness tool inside us, and that indicates we survive in the world. We actually pass the fitness test to survive, and when we end our life and when it's gone, that confirms we are no more. So between that origin and also we are functioning. We are actually able to go and to the beach. We are actually go to the restaurant. We are go to the cinema. We can chat with our friends. We can cook and other things. We can wake up in early morning and do everything. Oh, our body is functioning until one day when you feel you're struggling for hair, when you're waking up in the morning. And that's when the threatening situation happens and people realize that they have a lungs to breathe. Until then, no one cares. Yeah? And that is what we want to make a change. You need to make care. And more so than the lung, our body is so much well designed and it's so much connected to everything internally. You think that a person with diabetes thinks it's only a problem with their kidney or the pancreas, which is not. People have just in the research have proved people with COPD are very much prone to get diabetes. And this is the research from the UK Biobank published 2 years ago. So a lot of things are not aware in the public about the seriousness of this, how serious it is, and what all the mission of MindBody Synergy CIC, the community is serve the public, low-income groups, under-reserved groups, both public and the healthcare professionals, to train and create the awareness. We provide training and workshops and webinars to support people, and also subsidized therapies. And Tele-Therapies provide, is not subsidized therapies, it's Tele-Therapies.
Would you be looking to train?
The healthcare professionals who are dealing with chronic respiratory disease and the mental health care professionals. In the inhaler, which actually the people have been given, have a steroid in it already, and the steroid increases the anxiety in people, and people already struggling with breathlessness, and it is actually not stopping the anxiety, it is increasing the anxiety of the people. We cannot actually give a pure system where everything is right. There is something which is actually side effects and other thing. But what I'm trying to say is people need to have the right support from the start. For example, if a person has been prescribed with an inhaler, they should also be referred to a mental psychologist or a psychotherapist, because people who are coming with a COPD doesn't only have COPD, they might have past mental health issues.
Yeah. Do you think the numbers would be a little bit too... You know, you're talking about a huge number of people. If you... It's not necessarily different.
So in terms of, from what you're saying is, the government is there to protect the people.
Yeah.
The healthcare system is there to protect the people. It is actually, they cannot back up by saying, oh, this is a large number, we cannot serve. We are paying tax. And the tax is to be distributed to the healthcare in a right way. And there are also evidences, the NICE guidelines, the BTS guidelines, the ERS guidelines, the ATS guidelines, everything confirmed.
But that's for the GPs there, isn't it? To assess if that person needs such a treatment.
Sure.
Obviously, they put their healthcare plan right in front of them.
Exactly.
So that's why it's there, not just to try and save money, but to assess initially if that is required.
You're right, 100% right. That's what I'm actually talking for, which is not happening right now. Yeah, there is no integrated system for chronic respiratory disease.
So just going back a little bit, why is it with somebody with COPD need a psychotherapist?
So a person with COPD with breathlessness, COPD have breathlessness, yeah, and they would be actually having prescribed with all the medication, including in medication with a steroid. The steroid increases the anxiety. Anxiety again increases breathlessness. So also people with COPD might have the past mental health issues, yeah, and all these factors will contribute to how well the person is engaging with the management. We have a lot of attrition rates of people disengaging with the prescription of inhalers, disengaging with pulmonary rehabilitation, and overall globally pulmonary rehabilitation is lung rehabilitation. Yeah, because you're a healthcare professional, I believe you understand that. So there's a very low referral rate to the lung rehabilitation, and communities doesn't know, do I need to take care of my lung until I get to the stage where my lung is not able to support me? There's a lot of other things tangled to this. There should be a new system where people need to be diagnosed. If they are going to the GP with COPD, there should be a very clear past medical history should be noted for the people, and to help them to engage with their treatment plan, they should be assessed by the psychologist or psychotherapist in every GP center whether this person is going to be engaging with their care plan. Teletherapy, if you visit our website, you have an answer for that. So we actually give lung behavioral therapy. We don't actually do a normal respiratory thing. We do a lung behavior change, because any action a person should do, it is a behavioral change that needs to be brought on for their engagement into that particular thing.